the Director of Internationalism in JCI Baccalaureate Incorporated, and the former president of the Pythagorean Toastmasters Club. Mosto, she is licensed regular member of both the Psychological Association of Philippines and the Philippine Guidance and Counseling Association. She is also the founder of Articulate Psychological Center and a strong gender advocate. Let us all welcome Dr. Donalyn Lastima. Welcome, Doctor.
Good evening, everyone. Good evening from the Philippines, but good morning. I don't know in Australia, is it morning or other parts of the world? Maayong aga is our maayong aga, maayong gabi, or maayong ugto. That's our greetings. But yeah, good day. I'm so excited to be here. Thank you for giving me this opportunity to share with you coping skills, or topic that is related and close to my heart, the mental health advocacy. So good evening. I think we're all ready. Thank you for sharing. All right. See, as mentioned earlier, I am a guidance counselor by profession, but I'm also a professor in one of the my university is Technological University of the Philippines, Visayas. So my topic, or the topic assigned to me to be part of this series of talks on mental health, is entitled Battling Issues, Confronting the Youth's Mental Health. So I think this topic is very timely, especially during this time, during this challenging moments. Especially when we talk about mental health, it's very important to look into our mental state, right? Sige, let's move on to the next part. There, so that's my greetings. Thank you for having me. Now, hello, Philippines, hello, world, and hello, Prime. Thank you for having me. You can call me Doc Dawn. And tonight, we're going to talk about very basic topic, but I think this is relevant to all of us. Sige, let's move on. So we're going to talk about mental health, of course, the youth and mental health, the Philippine scenario on mental health, and of course, the COVID-19 pandemic, how it affects our mental health, and what are the common issues that affects the youth of today, and how do we reframe our mental health, and how do we cope better. That's the outline, that's the expected output. Moving on. Our national hero, the Philippine national hero, Dr. Jose Rizal, would always emphasize that the youth is the hope of our future. So when he said this, he's very positive that in the next years to come, the youth, or the next generation, will be the next generation of leaders, the next generation of teachers, engineers, and mental health advocates. And right now, we have high hopes for our youth for the future. And it's very important to take a look at the mental health of our youth, because as the next generation of leaders and next generation of professionals, we have to be sure that we are on the right track, that we are equipped with not only the knowledge, but of course the psychological capability to be the best version of ourselves in the future, right? Then, of course, when we talk about the youth, who are the youth? Is it something about the age to determine the youth? No, youth is best understood as a period of transition, no, from the dependence of childhood to adulthood's independence. So by the World Health Organization, youth is defined as 18 to 24, right? But in Junior Chamber International, which I am part of, an international organization, we view youth as 18 to 40 years old. So it basically starts from 18 and it ends in 40, according to Junior Chamber International. But basically, I'm sure that majority of us here are all part of that population, right? So we are the youth, we are the hope of the future. Okay, moving on. So the youth actually not only represent the future of our country, but of course, we are one of society's main agents of change and progress. So like when we do something, it reflects of what community, what society we are in, and what will be the future of the society based on how we behave, how we act. So youth have a great effect on economic development too. So we are important in the economic development of our country. In this stage of our lives, we build many social relationships, right? So we develop relationships, we make friends, we interact with one another, we develop networks, and of course, developing our personality that would define us as the new generation of leaders, the new generation of teachers, engineers, and professionals, and accountants, and businessmen, and entrepreneurs also. Okay, so the youth has a great role to take on, especially when it comes to leading the nation to the next generation to come. Okay, moving on. And what's so important, about the youth's development, it's very important to take into consideration the mental state of the youth. And when we say mental health, what do we mean by that? No, by the definition of World Health Organization, mental health is a state of well-being. Actually, when we talk about mental health right now, it's not only the absence of mental disorder. According to World Health Organization, it defines four major factors that would help us understand mental health or get us a better perspective of mental health. One, you have to check on if this person realizes his or her own abilities. Like for example, in school, you realize that you still have ability to listen to your teacher, do your homework, or submit your assigned tasks on time. You realize that you have your own abilities. You can cope with normal stresses of life. Like for instance, since the class or the transition from virtual to face-to-face has been going on, challenges is also high when it comes to student life. So if you can cope with the normal stresses of life, then you have to check, based on the state of your well-being. If you can still work productively and fruitfully, you can still help others. You can listen to your friends whenever they have issues or problems. If you are able to make contribution to your community, that's also an indication that you have, in one way or the other, a very good state of well-being. So four major things. It's not just the absence of mental disorder, but in fact, comprises or summarize these four major factors to check whether we are still okay or not okay. All right, moving on. So when we talk about mental health, of course, in connection to our topic, we really need to look into the issues that affects the youth of today. And what are the issues that affects us? So global economy, that's one. According to the brief of United for Global Mental Health, it says there that global economy is losing more than $1 trillion a year due to depression and anxiety. That is something. About half of all mental health conditions begin by age 14, with suicide being the second leading cause of death in young people aged 15 to 29. So this age group basically shows the age bracket of the youth, as mentioned earlier. So even lower, right? So we only started by defining it as 18 to 27, but look at the statistics. It starts from young as 14, 15, especially in the case of suicide. And that is something that we really need to look into. What are the reasons? What are the variables? What led this situation for the youth to think about this, right? In contrast, low and middle income countries allocate less than 1.6% of the national budgets to mental health. Now, even in the Philippines, we have a budget allocated for mental health. Okay? Sige, moving on. Let's take a look at specifically on the youth. Now, what are the key facts according to World Health Organization? Globally, 1 in 7, 10 to 19 years old experiences a mental disorder, right? Can you imagine that? 10 years old to 19 years old, they've already experienced mental disorder, accounting for 13% of global burden of disease in age group. It's very surprising that in the Philippines, mental illness ranks third among the illnesses being faced by Filipino. So third among the mental health condition. Depression, anxiety, and behavioral disorders are among the leading causes of illness and disability among adolescents. So it is based on these statistics by World Health Organization. It is a fact now that youth of today experience depression, anxiety, stress. Suicide is the fourth leading cause of death among 15 to 29 years old, which I've mentioned earlier. No, suicide is also an agonizing and very challenging mental issues being faced by youth of today. The consequences of failing to address adolescent mental health condition extend to adulthood. Of course, if we could not address the concerns of the youth, what kind of future are we looking at this point? So it impairs both the physical, the mental health, and the opportunities will be limited to lead, of course, a fulfilling lives as an adult. So it has a domino effect. That's why it's very important, this topic and this session is very important to look into. We have to recheck, reflect. If we are the youth of today, how are we coping? How are we now, right? So these are the facts. Okay, let's take a look at the statistics in the Philippines. Now, for our international participants, you might want to know, or even our participants in the Philippines, it's very interesting to take note of the mental health issue in the Philippines. Of all the most common morbidities that afflict Filipinos, mental health or mental health illness ranks third. 1 in every 5 Filipinos experiences or suffers from mental health problem. And take a look at the statistics of our mental health professionals as compared to the population. So there are only 700 psychiatrists and 1,000 psychiatric nurses in the entire country with a population of over 1 million. Like counselors like us, we are, the range would be from 2,500 to 3,000. Of the total budget allocated of the Department of Health, 5% is allocated for mental health. So only 5% is given to mental health. And overall, the most common mental health disorder in the Philippines are, 1 is schizophrenia, 22 to 44 years old, so within the age range of youth. Second, substance abuse disorder, post-traumatic stress disorder, and still depression. So globally, depression has a phase among the experiences of youth, but in the Philippines, it also ranks fourth, right? And suicide is another creeping mental health problems in the Philippines. It's not only in the global scenario, but in the Philippine setting. In 2012, actually, 2,558 Filipinos killed themselves. In this digit, 2009 were males. And the cases of death due to self-harm increased in the Philippines, especially during the time that the country struggled to reopen amid the failed pandemic response. And it hasn't increased. No, every year it is increasing, and it's creeping. No, when we take a look at that. Now in the Philippines, we have the Philippine Mental Health Law, or the RA 10036, enacted in 2018. What does it say? Now, the law actually was established as a national mental health policy. This is in response to the creeping cases of mental health illnesses in the Philippines. So 1, to enhance the delivery of the integrated mental health services. So we do have a community-based mental health services. It promotes also and protect the rights of persons utilizing the psychiatric, neurologic, and psychosocial health services. Very, very fast. It has 4 components. The mental health law has 4 components. 1, it helps us secure the welfare of mental health professionals and the person with mental needs. Second, it provides mental health services in hospitals and in the community, in the barangay level. Improve mental health facilities. And lastly, it integrates the mental health education in schools and workplace. So to respond to the needs of mental health issues in the workplace and even in the school setting. Right now, in my experience as a counselor, the cases being presented to us during the session has been shocking. No, for when we think of cases before, it's more on school-related concerns, not submitting assignments on time. But right now, it has been we've do counseling with cases or clients with diagnosis. Some are taking medication and the like. Sige, moving on. So that's this is the Philippine mental health law. So, but basically, when we try to look at the mental health challenges, now regardless of the presence or absence of a disorder, all individuals and families are at risk of stress and situational psychological distress. Correct? Do you agree? Even with or without disorder, we as normal human being, we are beset by different stressors. We are challenged by different mental health concerns, crises that we really need to look into and to address so that it will not end up into something that's not that's out of control, right? So let's take a look at the Philippine scenario, like during right now, in the present time. So when we try to remember 2 years ago, like during the lockdown, the Philippines has been one of the countries that's so strict in implementing the safety protocols. But at the moment, let's take a look at the statistics. Right now, we have this one is the recent statistics shown in the Department of Health. So the total cases right now is 3.9. And there are active cases still, but it has also statistics with 3.9 that recovered, but still deaths, we have 63,000 more or less deaths caused by COVID-19. So try to imagine, try to take a look at these statistics. Although it has been the condition and the situation, well, I can say it's quite mitigated, but still there are cases, so it's not yet safe still. That's why we are asked to wear our mask when we are in public, and we have to be very careful with the protocols also. And let's take a look at the vaccination, the status of vaccination in the Philippines. So the total doses administered, we have that number. So basically, when we try to check on the statistics, more or less, the population is now fully vaccinated with doses and boosters as well. That includes young children also. Like that's the situation in the Philippines, which somehow give us, well, as observation, give us also a sigh of relief, because when you are vaccinated, you can move from one place to another. Just need to bring your booster, your proof, and anything. So it means you can now move from one place to another. You can travel. And that's a good sign now, because we end up into, moving from one place to another, meeting people which we were deprived of for 2 years. Okay, moving on. Now, new normal. So basically, we do not call this the this is the new normal, or hopefully, the better normal in the long run. New normal, of course, it brings new issues. So when we say new normal, it is the state in which the economy, our society settles after a crisis. So after this COVID-19 pandemic, are we settled already? Are you settled in your own countries? Now in the Philippines, we're trying to settle. Now when this differs to situations prior to crisis. So the situation greatly drastically changed after the COVID-19 pandemic. So during the COVID-19 pandemic, the term new normal has increasingly used to refer to the changes of human behavior during and after the pandemic. So like, for example, you can see in the picture, the children long time ago when they were playing before the pandemic, they're just free, to play, not wearing the masks. But right now, it is a must to wear a mask, especially in the Philippines, and if you're in a public place and in an enclosed area. So basically, it changed the way of thinking, our perception, and also affects our coping, right? Okay, moving on. Okay, now as the coronavirus surges, pandemic fatigue emerges. So this one issues that's been faced by teenagers or youth of today also. So pandemic fatigue marks a mental health crisis. So when you experience pandemic fatigue, no, you feel so tired of the situation. When is this going to end? How am I going to start my life again? So that marks a mental health crisis. Am I still getting married, or am I still going to see my crush or the person that I like? No, after this, people are weary, right? Like, for example, like you're thinking our family, you're thinking of the safety and security of the family in the next years to come. There is also fear and anxiety. People of varying ages and genders are weathering this pandemic storm differently, right? But more or less, it affects our mental state, right? And it challenges us to cope and to do things that we want to do. It gives us limitations, but at some point it also provides opportunities for us to thrive, right? So but this is a fact that the coronavirus surges, pandemic fatigue emerges, and new issues, especially in relation to mental health issues, also emerges. And as we enter in 2021, this is from Psych Today, the science behind pandemic fatigue. So we feel exhausted by the ongoing disaster, discouraged by the ambiguity of when the disaster will end, even up to now, right? Even if we are allowed to go out, but still there are some lingering questions about how would this end? When will this end? And many of the youth feel lonely. They feel so isolated. Some are feeling anxious, some feeling depressed, no, dealing with traumatic stress, alongside with several psychological, physiological, and relational challenges. No. Many are experiencing pandemic fatigue as the question still looms when the pandemic will end. No. Hopefully, it will end. All right. We actually, according to Secretary General Antonio Gutierrez of the United Nations, now we must see the countries not only united to beat the virus, but also to tackle its profound consequences. So what does this mean? It gives us a message that we really need to act as a team. No, we need to act as one, especially when it comes to corona, in fighting this battle. It doesn't only end in relying to the frontliners, but of course normal people, or like each member of the society, should take its part, should be responsible, should also contribute, so that we can beat this virus altogether. And the COVID-19 and the youth mental health, when we try to look at researches or studies, it says here that infectious diseases such as this COVID-19 may have immense influence on youth mental health. So it's true, it's a fact. According to the study of Liang, Ren, and Cao in 2020, diseases like COVID-19 has an impact, immense influence on youth mental health. And youth mental health actually was significantly related to being less educated, being an enterprise employee, suffering from PTSD, and using negative coping styles. So it means to say, if you are a youth that has poor coping style, you will be greatly affected by these factors brought about by COVID-19. If you are less educated, you suffer also from the post PTSD, you have symptom of PTSD most likely. You will have a really hard time coping with the new challenges or the challenges brought about by COVID-19. The psychosocial effects of COVID-19 disproportionately affect young people. So the effect seemed to be so big, so large. And when you try to look at the youth, they're just really trying to cover themselves up. How would I supposed to protect myself? What are the things that I should do? So that is something that we really need to talk and discuss further. How to protect ourselves, how to keep us afloat amidst this COVID-19 pandemic and challenges. Okay, moving on. now. So how do we monitor the mental health of our students during the pandemic? Like in my case, I've mentioned also that I'm a professor in a university. So we use virtual platform in doing class. Uh, I'm sure in some countries like Australia, you're also doing that even before the pandemic. But in the Philippines, it's quite new, especially during the lockdown and after the when we were allowed to go out, but with restrictions. But some of the classes are really into virtual. So basically, as a teacher, how would I monitor the mental health of my students when all I can see are photos, or like I can only see that is something that we need to really look into. So students who are already at risk for mental health problems, but the pressures of the pandemic are compounding the issue, right? The online classes, let's take a look at the picture. No, the online class, especially for young children, is getting serious with the mother, with the mother beside the student, looking into how would the child would answer the questions from the virtually and so on and so forth. So it's a challenge. It is more difficult to detect mental health issues through virtual learning platforms. It's difficult to detect even in the face-to-face context, how much more if you are uh, using the online platform. How would I know that if you're okay or not okay? If you're not, tell me or set an appointment with me. Okay, moving on. So social connection is very important. Of course, in this developmental stage, no, the youth also needs people. Connection is important. Affirmation and validation coming from peers are also equally important. That's why in a study by Power, Cotter, and Cannon in 2020, both immediate and long-term factors through which young people are affected, that includes no social isolation. That's why social connection should be encouraged, changes to the delivery of therapeutic services, and almost complete loss of social structured occupations. Like before pandemic, there are structures or structured thoughts that we follow, like what time, when are we going to wake up, what time are we going to go to school, what are my classes. But during the lockdown, everything else, we've been in the, it seems that we've been we're confused. No, we don't know where to start, we don't know what to do. Then the transition happens, we are allowed to go back to school, and the youth is really, teenagers or students would think, how am I going to start my life again? So it affects now the mental state. And that's why social connection, social support, and affirmation, validations are important, are important factors that will really help the youth when it comes to dealing with their mental health. Now, how do we reframe the mental health of the youth? Yeah, moving on. So I've mentioned that we don't need to rely it to just one group of people, to the family, to the school, but it should be, there should be contribution to each member of the society. So local governments, like your national governments or local governments, should develop effective psychological interventions for youth groups specifically. Moreover, it is important to consider the educational level and occupation of the youth during the intervention. Interventions are very important. So like if the government could really promote or create ways of to intervene depending on the age bracket. No, like for example, if we deal with children, if we deal with adolescents, if we deal with young adults, so we need to develop different interventions. Another one, how do we reframe our mental health? Opportunities within the crisis exist for service providers to scale up their telehealth and digital services that may benefit service provision for young people's mental health in the future. Here's the thing. When we look at the crisis, we don't only look, ideally, we should not look at the crisis only as delimiting, or it limits our ability. But we also need to look at the crisis as an opportunity. Now, what are the opportunities that's being presented before us? So, like for instance, for us, mental health professionals, doors have been opened for telehealth, for telecounseling. Doctors our medical doctors are doing consultations online with digital services. So this pandemic also brings or brought us new challenge, new changes rather, that at some point we don't even imagine that that could happen, right? So that's one thing of looking at the mental health state. We reframe our thinking. We look at the possibilities and the opportunities, that's being presented before us. What else? How do we reframe our mental health? We cultivate resilience. How do we cultivate resilience? And the timing of exposure to risk and resilience factors is likely to be consequential in predicting the mental health sequelae of the pandemic. So, like when we look at the pandemic, we also listen to stories of resilience, listens to the story rather of survivors now. The story of grit, of resilience, their persistence, their perseverance to, survive. And our own lives are manifestations of surviving. And when you try to you know, uh, look at the future 10 to 20 years from now, when you have your own family, you could tell your children how did you manage to survive the COVID-19 pandemic, and we can learn from that story, right? So, but at the present, cultivating resilience is also very important factor to, to battle the mental health concerns or problems. Checking into your ability to cope and ability to bounce back and bounce forward after a traumatic incident or, a crisis that had happened. So it's very, very important to cultivate resilience. Okay, what else? And at the social ecological level, this includes the healthcare system. So, right, when we take a look at our healthcare systems, how do they manage this crisis? Because it will also reflect on how they would manage the future crisis that would happen in the world. And of course, take a look at the policies that's being implemented, the COVID-19 protocol and all those stuff. No, is it effective? Is it functional? Is it relevant? Is it helping? No, does it support family also that's facing crisis? So that is something that we really need to look into when we reframe our mental health. And at the family level, of course, family is also the basic unit of society. So we try to look at the family level. This includes the nature of relationships in and among family members. Is the family members, or is the family a source of support or a source of turmoil of an individual? Is the family supporting? Is it positive? Is the relationship positive? The patterns of communications, are they open? Are they good? The rules and rituals and the belief system, are they, is it meaningful? Is it relevant? Because as a counselor, I do believe that family really plays a great role or a vital role in the mental, in developing a positive coping and in the mental state of an individual. Especially, like in the context of our culture, we are family-oriented Filipinos. Are family-oriented. We really bank on to our families when it comes to support. So try to imagine if you have this COVID-19 pandemic and you haven't received this kind of support. So it will be very difficult and challenging. All right, sige, moving on. Now, we are now coming to the point now of letting you know how would we face our adversities. So we battle like the chess, like in chess. Now we go to the battle, but how do we prepare for the battle? But when we go to battle, we need to prepare. We need to prepare and be ready for it. So how to battle issues that confronts the youth mental health as of today? One, I think it's important to keep informed. So it's very important that you go to websites that's legit and that's of course the source is legit, and the sites, you're sure that the sites, that the information presented in the sites are also product of research. So you have to keep yourself informed. You don't need to rely on Facebook posts and the like, but you have to really check on the source. Have a routine. Adolescents or students are encouraged to have a routine. What kind of routine is that? The basic routine, the routine that will keep you or give you a structure of what you'll do for a day. Like, for example, getting up. Now, what time are you getting up and going to bed every day? How do you keep up your personal hygiene? When was the last time that you took your bath or brush your teeth, right? So eat healthy meals at regular times. What kind of diet do you have? Is it healthy or it's not healthy? You have to take a look at that. Exercising. How do you exercise? You are encouraged to do exercise regularly, even 15 minutes walking or running. Allocating time for working and time for resting. Resting is a must. Sometimes we, as young professionals, sometimes we take rests for granted, but it's not actually, we need to really take time. It's mandatory to have rest, to relax at some point. No, make time for doing things that you enjoy. No, what are the things that you've been doing for the last 2 weeks? Are those things make you, gives joy and spark joy into your life? Or maybe you're just doing that because you need to do that. No, there's something that you need to look into when you do things. It must give you positive feelings, positive emotions. If not, I think you need to pause and think again. No? Are these things the things that I like to do or not to do? Right. So having a routine could help you battle with your mental health issues. What else? Okay. It is also important to minimize news feeds. Yeah, I know that social media are like, we are now in the digital era, and we cannot discount the fact that we live no in a world where in social media, virtual, the digital self is also another part of the self. We project something out of our news feeds, but it's best also to take time to put schedules on how when are going to use your Facebook or whatnot, no, or Twitter check on. It's best that you have time. You minimize news feeds, but you will not feel so overwhelmed by the information presented before you, right? Moving on. What else? It's also best to, okay, sige. Moving on to the next part. Okay. Hi. I think it stopped.
Ranveer.
Okay.
All
Yeah.
right.
Are you
I
all
think
right?
it must be a technical issue.
It's okay now. But anyway, going back now to news feeds or digital self, no, like in when we try to look at ourselves, no, there's right now it's an emerging self, the digital self that at some point, whether we like it or not, it's been an extension of the self that's been mostly presented to the virtual world. So it's also best to check on the alignment of your digital self to the real self, because it also gives sometimes problems to teenagers, like projecting something that you're not, and it's difficult to maintain. So yeah, and digital self should also need to look into. Moving on. Okay. Minimizing news feeds. Also, we also need to social contact is important. No, the next part of the presentation is social contact, which gives premium to social relationships. We are social animal. We need each other to survive. Although that's so, well, you can say that's so that's part of our collective consciousness now as Filipinos, that we need people, we need our family, we need social connections. But I do believe as human being, we need each other to survive. Now, as part of being human, it's part of humanity. We need to contact and communicate with other people using a language, our gesture. So like in times that we need someone to talk to, we call to friends, especially if we just want someone to sit beside us and listen, right? So social contact is important. Like in the Philippines, there's a crisis hotline. Now, whenever you want to talk about, if you are thinking of harming yourself, you can just dial this number. Now, USAP, the National Center for Mental Health. In our region, there's also a local number for that. Now, whenever someone is thinking of harming themselves, you can just dial a number. So you can talk to someone. I'm sure in your countries, there are also hotlines that you can call whenever you want to, talk or discuss about mental health. So social contact is important because we as human being, we are wired to connect, to one another. So it's best that you have someone to talk to or a person you can run to whenever you want to talk about your feelings and emotions. And of course, you will not be judged. They will just accept you as you are, especially those people whom you trust. Okay, moving on. Okay. Social contact is important. Now, it's also important to look into our lifestyle, no alcohol and drug use. We have, well, in the context of the Philippine setting, no, alcohol and drug use are no because they damage not only the physical body but also the thinking. So instead of doing alcohol or drug use, maybe you can find something functional to do or productive things to do, like for example, do exercise, do yoga, help the community, connect with your family member, and the like. Moving on. Right. Screen time is important. No, like how many hours do you spend for checking on your phone? So you have to be aware of how much time we spend in front of the screen every day. It's not only on the phone, but also in your laptop. Like for example, you sometimes you feel so tired of looking at the screen the whole day and the next few more days, and before you knew it, it's a year. So you have to be very careful and be conscious and make sure that you take regular breaks from on-screen activities, especially to students. Make sure that you have a break whenever you're having classes online. Okay, moving on. Ayan, video games. Now, in my experience with my students, so most of the time they would report to class, and sometimes they come in late because they're tired and sleepy because of the extreme gaming or extreme engagement in video games. I don't know with other countries, but I think it's also a trend among teenagers, among youth, engaging in video games. So actually, video games can also be a way to relax. But of course, you have to be careful with the time because you can be tempted to spend more time on them, and it affects your well-being as well. So make sure it's balanced. And there's also offline activities other than the video games. It's also best to connect with people and do things face to face, like even just chatting or like smiling, sharing humors and the like. Right? Okay, moving on. And social media, I've mentioned this earlier. Now, use social media accounts to promote positive and hopeful stories. Correct misinformation whenever you see it. Like we are bombarded by different, information, and we are not sure if that information is true and correct unless you verify them. So it's important to, verify information. Fake news are just around the corner. So when you do use your social media, you use social media in a like this one, like promoting your advocacy, like creating positive feeling, or promoting positive feelings and hopeful stories to other people, not damaging them, right? So social media, use them properly and help others. Now, like when you help others, you offer your support to people, especially in the community who may need it, especially during, like for example, even just in food shopping. Like in the Philippines, during the lockdown, there's been a trend of, we call that community pantry, wherein the community shares a little bit of their things and put them in one corner, and people can just get it or exchange it. For example, like a tray of egg in exchange of a kilo of rice or something like that. So in the Philippines during the lockdown, there's been this is it's more of a trend, and we really like this because it shows also the generosity of Filipinos in the community. So like if there's a chance that you can help others, why not? No, do it. Yeah. Okay. Thank you. All right. Moving on. So help others can also help you battle the mental health issues that you feel. It will make you feel productive also. Okay. Moving on. Next. Yeah, and support health workers. It's important also that we help our health workers, especially during this time. So we also thank them in one way or the other. If you have family members who are health workers, you thank them, you also give them affirmations, because it's tiring. It's very tiring, physically tiring, to be a health worker during this time. But with the support and the affirmations, they will feel, at least it will boost their morale. Okay, moving on. And we do not discriminate them, right? So fear is a normal reaction of every people in this uncertainty, but sometimes fear is expressed in a way which is hurtful. So please don't discriminate our health workers. We have to respect and give them the support that they need. Okay, moving on. There. All right, Sige. So actually, I am nearing to the last 3 slides of my presentation. Like I've mentioned earlier, that suicide is also a creeping issue when it comes to mental health among youth. So it's important to know the signs. You know the warning signs, and you really need to connect to professionals whenever there's one in the community, or maybe just sitting there and listening to the person can also help. So it's important. So if you know someone who are on this path or going to harm themselves, kindly ask help. You refer it to professionals. Okay, moving on. And of course, no, help is here. Do not ever forget that. Sometimes you feel afraid to be judged. That's why you do not ask for help. But as a counselor and a mental health advocate, I am reminding you, everyone, that help is here. All you need to do is to look for help and reach out, to reach out and connect to people who can help you, because help is here. Okay. And lastly, don't hesitate to ask, of course. Yeah, and you have to remember, my dear students, or our participants, you have to stay strong, whatever circumstances you are in at the moment. I don't know, but I am reminding you to, stay strong. Your story isn't over yet. So just hold on. And lastly, I know it's been difficult, it's been challenging days in your part, but I want you to breathe. Like right now, you just take in, just breathe in, breathe out. And remember, it's just a bad day, but not a bad life. All right. So with that, I thank you for this time, the references. Thank you for giving me this opportunity to be with you tonight.
Thank you so much, Dr. Donalyn, for these wonderful points and tips that you have shared regarding the issues that the youth faces in terms of mental health. I'm hoping that everyone in this Zoom meeting had not only gained a lot of information and knowledge from Doc, but also became more aware of the great advantages in having a strong support system with our friends and family. So now we're moving to the last leg of the event, that is the Q&A session. Just a few reminders, please raise your hands first and wait to be acknowledged by me or Doctor before you proceed in asking. And if you are too shy or your mic is not working, you may utilize our group chat to ask your questions. I hope that everyone will actively engage in the conversation with each other. Please remember that this is a safe space, meaning that there is no right or no wrong, especially in the pursuit of knowledge. Thank you.